Okay, good morning, everyone. I'd like to open this Polk County Board of Commissioners. It's January 28th at 9 o'clock. All commissioners are present. Extra announcements are on the table next to the door. First up is comments for not on this agenda. Anyone would like to address the board? And I see nobody running to the mics. Next up is approval of agenda.
So moved.
And second.
It's improved and seconded. All those in favor, please say aye.
Aye.
Aye. Motion passes unanimous. Approval of minutes from January 21st, 2026.
So moved.
Second.
All those in favor, please say aye.
Aye.
Aye. Motion passes unanimous. And approval of consent calendar.
Move approval.
Second.
It's been moved and seconded. All those in favor, please say aye.
Aye.
Aye. Motion passes unanimous. That brings us to fentanyl-free Oregon. So Ryan Gale, Mary Louise Vanetta, and Mark Stewart. They're already on.
All right, can you hear me okay? Good morning. My name is Ryan Gale, and I am an administrator with Fentanyl Free Oregon, a nonprofit organization dedicated to learning and informing Oregonians of the deadly nature of street fentanyl. I am joined today by Jim Bauer, our board president, Professor Mark Stewart, our board secretary, and Mary Louise Vanetta, a fellow administrator. I want to thank the Polk County Board of Commissioners for the opportunity to explore ways to collaborate on awareness and prevention efforts. Street fentanyl continues to pose a danger in our region. The Oregon-Idaho High-Intensity Drug Trafficking Area Program's most recent threat assessment confidently predicts that fentanyl will remain one of the region's most serious threats in 2026. Overdose deaths devastate families, and long-term addiction erodes health, stability, and the potential for people to thrive. Unfortunately, Oregon youth are not universally aware of this danger. Research commissioned in 2025 by Song for Charlie, a national nonprofit, found that only 64% of Oregon teens surveyed had heard about fentanyl, and only 49% had heard of fentanyl being used to create counterfeit pills. In other words, 4 out of 10 teens have not heard about fentanyl at all, and only half understand the risk posed by counterfeit pills. Awareness is the foundation for preventing tragedies before they occur. By closing this gap now, we can equip youth with the knowledge they need to recognize danger, make informed choices, and protect those they care about. It's critically important to reach youth in meaningful ways. Every interaction matters, and we may only get one chance to make an impact. Therefore, messaging should come from local people that you trust and respect the most. Organizations that serve youth in Polk County are uniquely positioned to meet young people where they are and could become powerful partners in our shared prevention and awareness efforts. Youth don't want to hear from an ad agency in a distant city. They want to hear from real people in Polk County. Fentanyl Free Oregon has formally partnered with the Cascade Pacific Council of Scouting America and Punk with Purpose, 2 prominent organizations serving youth. Our team is ready to launch similar initiatives in communities like Dallas, Monmouth, Independence, and Falls City. We invite the Polk County Board of Commissioners to join us in leveraging this county's unique strengths to save lives and foster a drug-free community. Together, we can ensure that young people hear this message clearly, early, and from voices they trust. We respectfully request consideration for funding of support for Polk County's opioid settlement funds to help expand fentanyl awareness prevention efforts for youth in our communities. Thank you again for this opportunity to speak with you today, and we look forward to working alongside you to protect the health and future of Polk County. And with that, we'd like to take your questions regarding Fentanyl Free Oregon. Thank you.
Well, I will start by saying, first of all, I'm quite aware of this startup and this program and have been engaged with these folks, I think, since the very beginning and in alliance and partnership with Salem Health. So I want to recognize Salem Health for having the understanding and the strength and the finances to help get this started. And Jim Bauer's in the room and has been a key captain in making this happen, getting it started. And I want to acknowledge other folks in the room that have been great partners in seeing to it. And so our own FCO staff and leadership in doing the things that they do. But honestly, I say what we've done has not been near enough. And my position has been, since I first learned of opioid settlement money coming to municipalities and counties across the nation, that money is what we should be spending for this kind of work. And I have found, sadly, that we all across the nation generally have been woefully distant from achieving that goal. And so I've been trying for 3 years to find a pathway to see that the investments that come to Polk County from opioid settlement money get used for this very purpose. And so that's one of the reasons I've encouraged this group to be here, and I've encouraged others to try to get to this money to do this specific work. And I think that every effort that we make is a benefit for our citizens. If we save one life, it's a life worth saving, and it's the right thing for us to do. So I wanted to make sure to acknowledge all that. And thank you to Ryan and Mary Louise for the work that they do. I know they put in lots and lots of hours. All of you do, I'm confident, but I see their faces first, and aren't compensated for the work that they do in general. So I think it's a terrific effort. I would love to see the Mid-Valley step up. This isn't just a Polk County ask. I'd love to see the Mid-Valley step up and really help launch this and be better equipped to align with other partners and make it a much more robust effort. So I think that the key here is that their ask, at my encouragement, is that we invest, again, some of our opioid settlement dollars, and the same to any municipal communities that have been getting that money that don't really have the wherewithal to spend those dollars in the same way that we would. So that's my connection and that's my encouragement. And like I said, I've been at this for a while, and hopefully we will get to a place where we can see others jump on board and help make this effort thrive.
Commissioner Gordon.
Well, thank you all for being here. I really appreciate the efforts beforehand and presenting this opportunity for partnership today. I spoke with Ryan on the phone for a bit. We chatted at the Salem City Club event as well. And I would love to get involved in a more widespread, robust campaign that's targeted to Polk County at-risk youth. And one of the wonderful things is that our family community outreach prevention programs have already started a lot of that kind of groundwork to see what student, they've done some surveying of high school students, how they like messages delivered, what sorts of folks they want to deliver that message. For example, the biggest response was people with lived experience and the like. So I think we could really form a very targeted and effective campaign versus kind of a universal message. And we talked about that, Ryan, to make sure that we're resonating with youth in Polk County. So I think there's a lot of opportunity here. And I agree that I think some of our cities are wondering what to do with these funds a bit because they don't run public health or behavioral health programs, right? So I would love to see some convened meetings with city managers and mayors and just to perhaps build a Polk County campaign. I understand this is a 2-county campaign, but it might look a little different in Marion or whatever, but I really appreciate the opportunity and I love the potential, and I appreciate Commissioner Pope for bringing this to our attention. So can't do enough. There are some folks in Polk County also who want to build on the Overdose Awareness Day in August. They've started their launch last year, so that could be another opportunity for partnership.
Yeah, absolutely agree. I mean, our top goal here is to identify, the great work people are already doing and figure out ways to come alongside people and really bolster the already great efforts that are taking place.
And I'm just these two pretty much said it all. But what makes Polk County work is collaboration and unifying our efforts. So you're not doing the same thing somebody else is doing it. And so putting our funding together and coming up with a plan that's most effective throughout our county. And I know we have a lot of youth groups, not only our schools. I think a lot of people forget the youth groups. The Dream Center in West Salem, they've taken what used to be the flats there, and now it's the Edgewater District and the pride there. Graduation rates were 50%. Now it's 100%. And he has doctors and CPAs that have gone through that and now donating to it. But we're taking those low-income kids and we're having one-on-one. That'd be a great avenue for your message to get to.
Absolutely agree. You know, one of the things and during this process we looked into or just really thought about is that, you know, youth are not a problem to solve. They're an asset to empower. And if we can come and approach people in the right way that really inspires them to engage in this kind of work, I mean, we could do something in this county that's really, really incredible and it sets an example for everyone else to follow.
And I'm all about getting that voice out and teaming up to whatever we can do.
You might mention.
Mr. Chair.
Yes. Yeah.
Yeah, the Dream Center is a nonprofit as well. So I think it shows the power of partnering with a nonprofit to quickly and affordably move initiatives forward.
Exactly.
So to that end, one of the things, again, I would also recognize is that this organization doesn't have the same restraints as, say, our school districts do, for example. And I understand to some degree the restraints that school districts may have on their messaging and outreach to students, but there are limits. And then additionally, my issue comes to what are we doing for parents? And how are we communicating to just the average folks that may fall into this? This isn't just a youth problem. And again, this meets all needs across that entire spectrum of age. And I can tell you I'm a person who resists every opioid prescription that I can. I just came out of a shoulder surgery where enough opioid narcotic was issued to me easily for an overdose and or an addiction. And so I am so paranoid because of my training with fentanyl and opioids in general that I do everything I can to resist that. But I have the benefit of being trained and seeing all the opportunities for addictions that are out there, but not everybody does. And so while we really do make a fuss about best practices and attention to youth, it isn't just a youth problem. And so to me, that's the other thing that happens here. And I'm grateful to see an opportunity come forward where we can have someone who can run in a different lane than some of our standard institutional organizations. An example has been, you haven't seen any other organization, including our counties, that have gone out and put up signs. You know, the fentanyl signs that I've helped distribute and put around, for example, or big highway billboard signs that these folks have done. And again, with the help of Salem Health, they're not cheap, but they're not completely unaffordable, and they have reached out and made those things happen. Those signs touch everybody, and so it's not just a youth thing. And so where my issue comes to, and again, remember the opioid settlement money was never about youth. It was about average citizens who were being prescribed opioids unnecessarily or, you know, without any restraint. So that to me is part of this as well, as making sure that we're getting that message out for everyone to see. And so I think that this kind of work is a great addition to those that are doing good things already, and a great boost for those communities or governments who aren't doing anything. Because they do exist, and not necessarily here in the Mid-Valley, but around the country. So there's a lot of opportunity here that we can make example of. And I will be very honest and say, and these folks know, if I didn't know that there was an opportunity to use money that was specifically directed for this kind of work, I wouldn't be advocating that we would take money out of a general fund or take money away from anyone else to do this kind of work. This is a place where we know there's a lack. We know there's enough money sitting in these different pots, and we do know for a fact that there are communities going, I don't know what to do with this. So this is a great opportunity. And I should stop talking because I feel like sometimes when you're, yes, you should just stop. So
I would just add, if I might, please, Mark Stewart, Willamette University. I and my students, we do research on a public health level of trying to understand the movement of these illicit substances, not only in the state of Oregon, across rural versus urban communities, but nationally. And at risk of overstating the urgency of this, let me instead say there's a timing opportunity here. You will hear a lot, and we are reading a lot, and in some ways it's great news that there has been a decline in the number of overdose deaths associated with fentanyl. And in fact, even a decline in the amount of fentanyl that is moving through the system right now. Public health researchers look at that. They look in particular at overdose death rates, and they also look at seizure rates, drug seizure rates by law enforcement. And as recently as 2-3 weeks ago, one of the leading journals, Science, the other being Nature, for scientific research, published a study that looked very closely and identified what is essentially emerging as what they call a supply shock. And a supply shock can happen just like that. We know from our experience with methamphetamine that pseudoephedrine, once that started to get regulated, almost immediately the production of that narcotic fell. But it was a trough, it's a lull, and it comes back. And of course, now the new meth is an entirely different substance. That's something else that neither Ryan nor Mary Louise necessarily mentioned. I also serve as an advisor to Song for Charlie. And there they are realizing the need for the rising tide of addressing polysubstance abuse. So it would be great if we were just talking about fentanyl, but that has graduated now into far more extreme illicit synthetics. As I started to say, though, the timing of this research, and I brought a few copies to pass around if anybody's interested. Brent and his team may want one as well. But these, I've highlighted the final, or one of the 3 findings on the last page. And it essentially is saying there's opportunity. This pause is opportunity. That opportunity for treatment and prevention efforts. It's going to come back, okay? Whether it's because, the negotiations with China on their side, or even things that are happening in the domestic manufacturing in Canada. But what these scientists highlight is that these supply shocks happen. They do their best to try to identify what might be causing it, but they also recognize that unfortunately, it's going to return. In what form and in what way, we don't know. But one thing we do know is that press pills are a big part of this. So these are the counterfeit pills that are out there and a young person gets, and young people experiment. They're risk-taking at adolescence and such, which is why I'm really encouraged when I skim over this list of the things that Brent and others have going, in particular the social norms campaign at one of the high schools. That's going to be key. Amplifying that message in a language that young people not only understand, but are receptive to and ultimately appreciate, without the don't do drugs message, but at the same time, not necessarily thinking passing out naloxone is going to solve the problem. So I've said too much, but if that's of any interest, I did want to speak out in front of that because there is an awful lot of that going on right now where unfortunately too many counties, largely rural counties, are saying, well, I guess the storm has passed. I guess we got out of that. Happy to talk about xylazine and medetomidine and some of these other drugs that are now showing up in the illicit supply chain, but maybe another time.
You speak of the supply issue, and that's what this covers. And we don't often enough think about the demand. Why is there so much demand? And obviously the opioid crisis created demand for heroin. When that passed, the market filled in that demand. So that prevention, that messaging, I think is important in addition to the harm, preventing deaths and making sure folks have an opportunity to exit an addiction experience. So.
Right. And a lot of the campaigns that I'm seeing in that regard, and some of which we're forwarding as well, is this idea that's kind of a hybrid between the extreme swing of what came to be known as harm reduction during the pandemic and the anti-DARE type framework. And that middle ground is really messaging young people, not saying don't, okay, but consider. Not saying never, but maybe not now. Okay, kind of nudging along to that level of getting them to understand a little bit more of their own brain chemistry, a little bit more of their own neurodevelopment, so that they are participating, they have agency in this, as opposed to what we all know passes for peer pressure, especially through social media.
What are we experiencing in the Salem Hospital in the emergency room now? Are those fentanyl cases and overdoses reducing on a local basis? Or are they maintaining?
No, I can't give you exact data, but it's not like overdoses have somehow dried up around here. I mean, the challenges of them is actually determining what kind of overdose you're dealing with and being able to respond adequately to that. There's so much going on in this drug, this ability to use a drug that will alter you, and then the risk that goes along with it. Sometimes it's understanding what's being presented. And that makes it even more complicated when you think about velocity in an ED or the pathway to getting somebody through that and into stable care. This kind of changing of the drug and the way it impacts people can have an effect on those first 10 minutes of how you treat somebody, which is the most important part of emergency care. So I think we're worried about this still. There's nothing at Salem Health that's saying, oh, I read the statistics and this isn't coming our way. It's still coming our way. And it still worries us. I think without getting on a soapbox, I think that our region has a chance to do things because of the people in it, because of, what we all know about each other and the work that we've done. So why not try? That's really been the whole, what's behind Fentanyl Free Oregon is there was just this moment of where we realized there's just not a lot going on this is not a good idea, doing fentanyl or other drugs or taking the risk and not understanding the risk is not a good idea to just keep letting go on and on without having some kind of check. And that was the genesis behind this whole idea is somebody's got to stand up and say it. And I feel like everywhere we go, it resonates. We were just talking before we walked in here this morning. We had a very successful discussion with the scouting group, which is Boys and Girl Scouts or however you want to call it. But this punks group is a kind of an edgy, fun area to be involved in. But we're also thinking about places like 4-H and FFA and groups that we are already established where you can get involved in groups that are already organized and just make sure the message is in there. We've had some success in Salem Kaiser, even getting this message into the school district, which is not an easy thing to do, I can tell you, at Salem Kaiser. But there are places where it's easy to see that if you send the message, they're responding to it in a positive way. And we're not really in a position where we could go say, if we do this, we could track a diminishment of what's going on in the ED. It'd be an impossible correlation right now. And that's something that, as we worked on this project from the very beginning of Fentanyl Free Oregon, people were like, well, can you draw a correlation? If you do this, you'll do that. And this is such an evolving, as Dr. Stewart said, this thing evolves every day. One of the things that we hope to do is bring some people into Polk County who we've used in Marion County earlier, who are just in the know of what the landscape is on this drug. And it's an incredible thing to see, to understand the movement, the changes, how it iterates and changes, how it's used, the cartels that are involved in different parts of it. It's a remarkable business model that's really something. And in that way, it's never going away. This thing's too well built out for it not to be something that we at least constantly work on the idea that this is an unsafe choice.
Okay, so, Mr. Hanson, we had this conversation on the money side of this thing, and I think we chatted about, together, about a $25,000 increment, as I recall. Would you be completely uncomfortable with a 2-year commitment at $25,000 per year?
No.
So I move that we fund Fentanyl Free Oregon at $25,000 a year for this year and the following year for their request.
I'll second.
So Let's move to any more discussion.
Just want to reiterate that this is a commitment now, and I want to make sure we're collaborating with Dream Center and other community resources, because we can leverage those funds and your expertise to really cause a lot of dialogue and move the conversation. I know I'm just repeating myself, but it is important to the community, I think. I appreciate that.
And one question is going to come up that I always ask. What percentage of the money donated gets to the streets? What do you keep for administrative and costs?
Include the budget.
Yeah, so
I mean, there's no overhead for the most part. There's a small administrative cost of just keeping Ryan involved in this, but this is not, we don't have an executive director. There's no staff. This is all about, let's get it out there. I mean, and this isn't built to have an organization. It's built to be active and use the organization of others to get the message out.
And media, materials, all that good stuff,
Yeah.
your staff time or
Mhm.
agency time, yeah.
Mr. Chair.
Yes, sir.
As you have stated, cities are having a difficult time, at least our local cities, of distributing their opioid money, which they receive. You may want to invite them to the mayor's breakfast. That way they can get out to the leadership of those cities to, get their ask out and do that. That may be a valuable tool because they really have a tough time. You can only buy so much Narcan.
Right.
I mean, we have FCO and other avenues to utilize that money, but cities have a tough time.
Great suggestion. Thank you.
And you likely have already started engaging in that, I would guess. Okay.
Yep.
Putting schedules together with other governments, local governments. Yes.
Okay,
With this commitment, I assume next steps would be kind of a refined proposal based on
yeah,
the committed budget.
that would be our intent.
Okay. And if I could just provide a little anecdote to Jim's point that the word spreads and people want to engage. I grabbed a couple of signs from Commissioner Pope's office and put one on my front lawn, and then got a knock on my door from a neighbor whose sister tragically passed away from an overdose. And then he helped spread it to other folks at the school and just got the conversation out. So I think there's a lot of hunger for more direct communication with one another.
That's a great example.
Yeah.
Thanks for sharing that. We have found the same thing. You just get in a room and people will all of a sudden say, somebody in my life, their life was dramatically affected, their death, overdose. I mean, there's something here.
Okay.
the passing of Measure 110 and having illicit drugs legal for so long in the state of Oregon, we created freeways of drugs coming into our state and being shipped out of our state. It's going to take years to turn that tide.
Yeah.
So many of today's police officers have never enforced hard drugs. So we're retraining our officers now to recognize those signs. And then some of the laws that we have passed still protect those drug carriers from searches and seizures. And it's very frustrating. I think what you're doing is a great step. So we have a motion and a second on the table. I'd like to call for a vote.
Aye. Aye.
Aye. Motion passes unanimous.
Thank you.
Thank you. Looking forward to working with all of you.
Thank you for your time.
Thank you.
This is great.
Good luck on the next one.
So that brings us to public hearing regarding Housing Authority Board Member, Mr. Morgan Smith.
Thank you, Chair, members of the board. Should be relatively quick and straightforward. As you are aware, state law allows for the county commissioners to appoint board members to the Housing Authority Board, in this case, the West Valley Housing Authority Board. And with that authority, it also vests with the county commissioners the authority to remove commissioners from the Housing Authority Board of Commissioners. And the basic standards for that is for neglect of duty and a list of other things. In the present case, there is a commissioner, Jacqueline Jamison, who has been serving on the board for a number of years, and for the past year has not been engaged with any of the board meetings. She doesn't return calls or emails and hasn't attended a board meeting in over a year at this point. So this is a moment for her to come and make an argument to the commissioners to stay on the board. And I will note that she is not in attendance. So I'm happy to answer any questions further, any discussion, but the basic stance we have right now is we have a housing authority board member who's just not engaged with the board and not coming to meetings. And we would like to have her removed so that we can fill that spot with someone who will be engaged with the board.
Is this the resident
It is.
position? Okay.
Can you refresh my memory on the process? Maybe I've never even seen it, of removal and replacement. What are the steps?
They're separate processes. This is solely just for the removal. Ms. Jamison is the service recipient board member. They're required to have at least one member on the board that is receiving services from the Housing Authority. So there's no one lined up to fill the vacancy if it is created by the board. So the Housing Authority is aware of that, and they're working with their own kind of list of clientele to see if there's anyone that's interested and willing to serve. So that was a discussion at our board meeting yesterday. So.
We need an opening first before that process.
Correct.
can take place. Yeah.
Yeah. And then the filling of the process will be the same as any other process we do for the Housing Authority Board. But if individuals are interested, they can get a hold of Nicole. They will talk to the board chair of the Housing Authority. And then the Housing Authority Board Chair kind of lets them know what the role is. It kind of gets vetted through the Housing Authority Board Chair and then comes back to you for approval. But that'll be at a later date.
So do we need a motion to remove her from the board?
If the board, I think we can just go by consensus at this point, and I'll create an order for consent calendar next week so that there's an appropriate paper trail. So that if the board is in consensus that we need to have this position vacated, I'm seeing nodding, I will prepare an order.
Yes.
Next week.
Thank you for reaching out to this individual.
Been trying.
Okay. Is there a need for an executive session today?
No, sir.
Yes, sir.
All right. With that said, we're adjourned. Thank you, everyone.